Hello class, and this is Veterinary Basics Module 3, mostly with pharmaceuticals and things like that, veterinary pharmacy, a lot of herbal supplements and things in here as well. I'm going to go through this a little bit differently today, and I'm going to kind of, I don't want to say skip through, but you can read as well as I can read to you, and I'm not interested in reading material to you. I'm interested in trying to give you the information. Please hang in there and just see if you got specific, let me know. But let me go over the first introductory portion rather quickly, and then the drugs and get to the herbal stuff, and we'll hopefully this won't be 2 hours long to make you sit here and arduously have to listen for 2 hours. So we'll start off here and first start off with the conversions. Things you need to know, probably learned in school: teaspoons 5 mLs, tablespoons 15 mLs, just things like that for simple conversions. What we will cover in here is some pharmacology, some toxicology, and then cover some herbal agents. So, we veterinarians are trying to treat disease with drugs and surgery, and you need to understand drugs that these patients come to you. And there's no way I can the drugs that are out there. There's new drugs being added every day. I'm going to cover more common drugs out there, and probably showing my age a little bit by drugs. I'll mention maybe some of the older drugs, but yet they're still good drugs. So I will go through this. Drug names. A chemical name of the is the registered name of the drug. We don't call them drugs by their chemical names very often, like 1-methyl-5,7-chloro, 1,3-dihydro, 2-H1,4-zodiazepam 2,1. The generic name is what you're more familiar with. That's diazepam, and the trade name probably you're more familiar with it, which is. And I like Valium as a drug. It's a benzodiazepine. It's a GABA enhancer, potentiates GABA receptors, and a good relaxer, also decreases anxiety associated with it. And so I use it a lot in my dogs who have herniated discs, things like that. Doses: tablets, powders, capsules, suppositories, not used very often, which means that drugs in a sugar base. A tincture, which means an alcohol solution. Ointments, creams, injectables. Creams disappear and don't leave much residue. Ointments tend to have oily base, leave more of a residue. Prescriptions: all drugs prescribed to animals may only be done by a licensed veterinarian, and this includes vitamins, herbs, all these drugs. Basically, chiropractors, you got to be very careful here, because when you start recommending supplements, you're actually stepping into veterinary purview. Veterinarians can do that. Technically, you as a chiropractor cannot do that. You're stepping outside your realm. So I know even recommending C or glucosamine, those supplements, that can be a veterinarian. You have to have a valid doctor-veterinary patient relationship must exist, which means you must physically establish this relationship, and then veterinarians can prescribe drugs. Drugs that are prescribed by veterinarians must be properly labeled. I used to work with a veterinarian a long time ago who had code names: L102, L104. Well, the problem with L102 or L104 is if some picks up L102 and starts drinking it, how do the medical doctors and personnel know what L102 is? So you can probably label them. You put this for veterinary use only. You need to put drug name, what the species of animal is must be on there as well. The number of capsules or tablets that are in the medication, strength needs to be on there as well. Common abbreviations used on prescriptions: X means to dispense, SIG means around the label, SID is used in veterinary medicine, not used in human medicine. QD is used in human medicine. SID once a day, QD means once a day. PID is twice a day, TID 3 times a day, QID is 4 times a day, QOD is every other day, PRN means as needed, STAT means now, PO means per os, OD means right eye, OS means left eye. So just some terms. Controlled drugs, lots of stuff out now about the opiates being used, and veterinarians are now being under a lot closer scrutiny because of the dispensation of opiate drugs to people. Most of us now have registered our with the prescription monitoring program to be able to monitor opiate use and control drug use. Schedule 1 drugs, veterinary uses. Schedule 2 drugs, they are used, but it's really restricted: morphine, meperidine, hydrocodone, pentobarbital, things like this. 3, less abuse potential, anabolic steroids. But the opiates, most of the opiates are here. Ketamine is a general anesthetic, Schedule 3 drug, which means we have to keep track of these. We have to have DEA numbers. veterinarians have to have DEA numbers, drug enforcement agency numbers. We have to keep all these drugs and keep records of purchasing and dispensing drugs. Schedule 4, less abuse potential. Here the benzodiazepines are here. Tramadol is a Schedule 4 drug. Tramadol is a painkiller. It's a lot in practice if you're out there dealing with dogs and cats. It's commonly used. It's not an opiate. It stimulates opiate receptors. It's not an opiate, but it's a drug. People can abuse this drug. Schedule 5 is the lowest diphenoxylate, these type of drugs, which is used for diarrhea. Drug by classifications, we'll go through this. Analgesics, Tylenol, not ever use Tylenol in cats. Tylenol is toxic to cats. Tylenol can cause death in cats. So not used. Again, you can use it in dogs. I don't ever use it. Can cause liver toxicity. Tramadol now is a Schedule 4 drug I was saying before. It does get receptors, can cause sedation in some animals, and here are the dosages. I'll never ask dosage tests that I ask you, but they're here for you for your reading pleasure, and it's a very commonly used drug nowadays. But again, we got to monitor this as because it's being abused by people. Analgesics, again, aspirin. I'm a person, I like aspirin in dogs. Works fairly well. Got to use it carefully in cats. Cats don't metabolize solution very well. They have decreased clearance in cats. I don't use it in cats. But it's just a general painkiller in dogs. One of the first drugs I go to. It's fairly safe. You should give it with food. You should watch for gastric, watch for GI tract bleeding, just like in people. Also, make sure if a dog's on aspirin, that you take it at least 7 days prior to surgery, because it can platelet aggregation and cause bleeding. This was a drug that came out, probably 20 years ago or more now. Everybody on Novox. There's lots of different names that give ibuprofen. Used to treat musculoskeletal pain. First, phenomenal drug. We didn't really have a drug that worked near this good in animals. A lot of these arthritic dogs really respond well to carprofen. The problem is it can cause hepatotoxicity, so blood work should be done prior to starting carprofen in animals. And again, this hepatotoxicity is rare now. It's really common when it first came out, but it's rare now. Don't use it in dogs with GI tract issues, and don't use it with glucocorticoids. This is a big warning here. Do not use any NSAIDs with glucocorticoids. Can cause your GI tract problems in dogs with this. Just be very careful about that. We're dealing cats. I don't, but you can. It's supposed to be used. Deramax is a cocksucker, fairly good NSAID, anti-inflammatory pain treatment for animals. I've used it some. You've got to be careful for GI tract issues. It causes GI tract. You look for blood in the stool, things like this. And again, some of these I'm just going to kind of breeze through. Previcox is used for a lot of dogs with chronic hip problems, chronic hip dysplasia, things. Can be used both in horses and dogs. Banamine is a drug used very commonly in horses. You can use it in dogs and cats. I never have used it much. It can cause sinus or abscesses at site of injection. Used a lot in horses, though. Pain is a kind of very common pain killer in horses. Ibuprofen, do not use in dogs or cats. Use it in horses. Again, I'm going to leave this to the parents to talk to you about. Ketoprofen, and again, another type of ibuprofen. One of the profen drugs can be used in horses. You can use in dogs and cats, and I've never got much experience with this. Arquel, meclopin. Meclopin is used in horses and dogs. You can give it orally in dogs. Same contraindications as other aids. Metacom, Mobic's human form. Is used fairly commonly in dogs and cats. It's usually dispensed liquid, and it does seem to have good effects, similar to the effects of aspirin in dogs. Naproxen sodium can cause severe GI tract problems. I never used it. Phenylbutazone, butazolidine, is a common equine drug. Can cause GI ulcers in horses. In dogs, as you increase those, but very, very common drug used in equine. Bute is kind of a mainstay drug. Banamine and bute are probably the two most common anti-inflammatories used in horses like that, at least in my experience. Feldine, used to treat arthritis in dogs. Zubrin, one of the newer drugs out now, Okay, same as other NSAIDs, used in dogs and cats for DJD, joint disease, post-op pain. Acetaminophen, codeine, we'll talk about butorphanol, butorphanol, which is torpitrol, used to stop pain, also used to decrease coughing in some dogs. Fentanyl, I'd stay away from this, to be honest with you. It's 100 times more potent than morphine. Fentanyl is a very dangerous drug, and even handling fentanyl can be a concern. It actually affects the body's ability to monitor CO2 levels, and respiratory depression and death associated with respiratory failure is seen. So I would probably stay away from this drug. It does have use, but be very, very, very careful with it. Dilaudid, again, Schedule 2 drug. You're not going to use it often. Loperamide, Imodium, this is used for diarrhea in dogs. Can cause severe complication. Increases segmental contraction but decreases longitudinal contractions of parasites. Therefore, you treat diarrhea. Demerol, not used. Morphine, very uncommon, very seldom used in hospital settings. Morphone, no. Toluen, Toluen has been used in equine and dogs. It's used for analgesia. It's a Schedule 5 drug. Sorry, Schedule 4 drug. I'm sorry. Be careful with this drug. Codeine, used as an antitussive primarily in dogs with chronic cough. Ketamine is a general anesthetic used in dogs and cats. Used for short-term veterinary procedures. Or safer drugs now out there like propofol. Propofol is an excellent acting short-term anesthetic for dogs and cats. Ketamine is a Schedule 3 drug. Ketamine is abused. Ketamine is very similar to the street drug angel phencyclidine that people abuse. They hit it up. It's also used as a date rape drug. Ketamine is you need to keep this stuff locked up in under key. This was not scheduled until the last 20 years, but that's a Schedule 3 drug, and you got to keep up with this drug. And a lot of veterinarians get away with this because of its monitoring that you have to do. Xylazine, Wampum, an old drug, but it's been around a long time. Used to sedate cattle, horses, for neutering, things like that, using cats and dogs. It does cause vomiting commonly in dogs and cats. So, barbiturates, again, not used very often. These are general anesthetic types. Inhalant anesthetics, these drugs used to induce general anesthesia. And sodium, chondroitin sulfate, glycofex, cosequin, things like that. Cosequin is actually glucosamine hydrochloride, but there's actually stimulating the synthesis of cartilage. Use a lot of these agents in these dogs with intervertebral disc disease, glucosamine hydrochloride, sulfate. The polysulfate and glycosamine glycans, again, used for arthritis, the chondroprotective. These drugs are a lot in arthritis in dogs and cats. Antibacterial agents are used very often, very much, but I will go over them some. Just different antibacterial agents with these fairly rapidly. Beta-lactam antibiotics, these are your penicillin. There's a cross-pronged allergic reactions in diarrhea in dogs and cats. Fluoroquinolones, do not use these in young animals. Disrupt cartilage synthesis, also a problem in people, and also older dogs. Cartilage rupture, ligament rupture, Achilles tendon rupture from these fluoroquinolones, so they can definitely cause ligament ruptures, arthropathies. Be careful of these dogs, cranial cruciate tears and things like that on fluoroquinolones. Nicotine can cause diarrhea, macrolides, Tylosin is used a lot for chronic diarrhea, believe it or not, in some dogs. Ponamides, you got to be worried about skin reactions, keratitis, KCS, keratica. Be careful using Dobermans, can cause issues in Dobies. Albon's used a lot for coccidiosis and coccidiosis in animals. Tetracyclines have can be used to animals. Young animals can affect developing teeth, bone development in animals, and young animals put on tetracyclines causes disruption of enamel in the teeth, can cause severe issues. These drugs are used for the rickettsial organism, or things like that. Anticholinergic drugs, atropine. Atropine is a muscarinic blocker. Used a pre-anesthetic sometimes, decrease respiratory secretions, things like that. Anticonvulsants, diazepam's a go-to for status epilepticus in these dogs. Phenobarbital are a commonly used drug used to treat epilepsy. Average age of onset of epilepsy in dogs is 5 years of age, and phenobarb is a common drug used for that. Real agents, I'm a big proponent of Pepto-Bismol, to be honest with you. My common treatment for acute onset diarrhea has gone on less than 24 hours. Fasted 24 hours, give them Pepto-Bismol twice, and on a bland diet, and you'll cure about 90% of cases of diarrhea, acute onset in dogs with this. Careful using cats because it does salicylate. Cats don't metabolize salicylates well. Activated charcoal uses an antidote for toxicities. Universal antidote for toxicities given activated charcoal. Antiemetics, drugs used to decrease nausea, decrease motion sickness. These dogs who have vestibular disease, have nausea and still moving around, who use or promethazine as a means to decrease their nausea and the spinning whirl they have due to their vestibular disease. Fungal agents, ketoconazole, these type of drugs used to treat antihistamines. Lots of these are chlorpheniramine, chlorpheniramine. The old antibiotics, Benadryl, diphenhydramine. I tend to get more current type of antihistamines out there. The Allegra, these type drugs seem to work better than standbys. DMSO, dimethyl sulfoxide, used as an anti-inflammatory agent. It's a primarily mixed with other drugs. The neat thing about DMSO is it causes the drug it's mixed with to be carried into the skin. You can actually get drugs systemically by mixing with DMSO. You've got to be a little careful though, because what happens is if you touch this, it's also going to get in your skin. So you got to be careful with that and watch that. Okay, so glucocorticoids. Gosh, these drugs are a mainstay of treating invertebral discs, things like this. The functional glucocorticoids, we can spend probably hours talking about glucocorticoids and how they work, but basically they're used as anti-inflammatories, and we'll just say that quickly. Exogenous glucocorticoids suppress the endogenous pituitary adrenal axis. For dogs on corticosteroids need to be slowly off, and what you'll see is usually they'll be used aggressively at first and then slowly weaned down over the next 7 to 10 days. They do impair wound healing, they do cause immunosuppression. You should not give them with NSAIDs or yucca, severe GI tract problems, things like that. Prednisone and prednisone are the two probably main go-to corticosteroids out there, especially used by the newer vets. I'm an old school vet. I like dexamethasone as my primary go-to for the treatment of invertebral disc disease. I think it's a better anti-inflammatory agent. Can actually use smaller doses as far as milligram dosages go, but again, it also has side effects like it increases water consumption, it increases hunger, so the dog becomes with the water consumption, tons of water, they become polydipsic polyuric, which affects clients sometimes because the dog will sometimes pee in the house. You got to warn them that ahead of time. It can GI tract problems as well. So I tend to always give food and give it with or some type of coating agent, some type of coating agent like Maalox or Mylanta. But again, very common drug, corticosteroid. You're going to see it. Probably the two drugs most of these dogs have invertebral disease will come to you on, which you may just a test question, or tramadol, prednisolone, and then usually some type of monoxide like Robaxin. Antibiotic agents, these are drugs used to treat worms, parasites, things like that in dogs. Parenteral pamoate strongyl T, very common drug used both in horses, cats as well. Flagyl used a lot to treat things from giardia to just non-specific gastroenteritis. It can cause, it primarily affects the anaerobic bacteria of the gut. Antibiotic agents, methimazole is used to treat hyperthyroidism in cats. Antibiotic agents, these are drugs used to decrease cough. And agents, again, these are people, cimetidine, these type drugs. Antiviral agents, behavior modifications. I'm not big on these. To be honest with you, they can be used in dogs, separation anxiety dogs, things like that. They're not the solution. They're part of this. They're part of the solution to the problem. In other words, they're part of the solution. They are not the solution to problems. Blockers, bronchodilators, diuretics used for cardiac disease, things like that. In dogs, Lasix is a very common drug used for the condition in dogs. Emetics used to induce vomiting. Hydrogen peroxide is coming on standby for dogs. Usually give 1 tablespoon of hydrogen peroxide for 20 to 40 a dog. Wait 20 minutes, and they should usually throw up in that period of time. You can, if they don't throw up in 20 minutes. Hormones, we don't use laxatives used for a lot of dogs, chronic constipation, things like mineral oil works fairly well, so it will affect fat soluble absorption. Pumpkin, if you use pumpkin, don't use pumpkin pie mix, use pumpkin. Pumpkin works pretty well to increase the bulk of the stool. Local anesthetics, mucolytic agents, these are drugs used to break down mucus. Also relaxants, that's Robaxin is a very common drug. You'll see prescribed by veterinarians for dogs with herniated disc disease. I like Valium. It does work better for me. Just seemed to work better. Opioid antagonist, tranquilizers, acetylmazine, vasodilators, vitamins. Again, I'm not going to go through all these. You can read them on your own. That question, tell me. Toxic agents, again, acetaminophen is very toxic. It's a liver toxin. Heavy metals, watch for horses, old barns, possibly painted with lead-based paints. Gypsum weed, organophosphate insecticides, don't use on cat. Can cause severe problems with cats. And there's drugs I didn't mention. Galaprint. Galaprint's a new anti-arthritic agent out there. Galaprint is being prescribed to dogs, a fair amount for dogs with degenerative joint disease. It's a safer drug, doesn't seem to upset the GI tract near as the other NSAIDs do, so it's called Galaprint. You'll see that as well. Toxic plants, just kind of go through this quickly. Different types of toxins out there, toxic plants that are there, and you'll see possibly in practice part of my state board exam identifying toxic plants, especially if you're dealing with cattle and horses. These plants are a problem. The arum family, these contain calcium oxalate crystals, and I mentioned because they're very common ornamental plants. You'll see in people's homes, and dogs and cats will chew on these. Again, Caladium, Dieffenbach, Dendron, things like that. They do contain calcium oxalate. Dogs that bite into these causes severe, intense salivation and pain in the mouth. There's no specific treatment other than just treat it specifically, but it can cause choking in the animals. This is what the calcium oxalate look like. These are what the dog's mouth, cat's mouth, who bite into these. When I had my mobile practice, one of the things I did was when I first came to a person's home with a new dog or kitten, puppy or kitten, I would ask to be able to go around the house and yard looking for potential problems, and I would identify these potential toxic plants to them for the purpose of trying to keep them from having issues. Here's clay. I've seen these. Here's a split philodendron. Where do you usually see these? In doctors' offices. Here's a wild-growing philodendron in California. Here's a philodendron going outside in California. Marijuana, blood press on marijuana now. And I didn't mention anything about CBD oil, but CBD has really been gaining a lot of popularity for treating muscular conditions as well as seizure episodes, things like that. I have several patients. Dogs have seizure episodes and are treated with CBD oil. It seems to be efficacious in the frequency of seizures. I've also had numerous patients asking me for the information, the tincture of CBD oil, and be given orally for dogs with skeletal pain as well as topical treatment for dogs. So all mammal cannabinoid receptors seem to work really well. For the THC, which is in marijuana, which is what causes the high. For it to become active, it must be heated, and so in most CBD oil has most of the THC removed. So I don't think it's worth the dog getting high on this stuff. It's being used a lot. What marijuana looks like. It's a marijuana leaf, very distinct leaf out there. You can see THC in some cases. Mistletoe is a parasite on trees. We see this around Christmas time. The berries are toxic to contain synthetic amines, cause pretty severe gastroenteritis in dogs. Oleander is a very toxic ornamental plant. Most commonly, when I show it to you, you'll recognize it, but it can cause cardiac problems, abdominal pain, diarrhea, and cardiogenic shock in dogs. This is the oleander plant. You've seen this probably growing around here, what the stems and leaves look like. Castor bean is also toxic. Contains ricin. Ricin is one of the most toxins known out there. Heat does inactivate, so castor oil, the ricin is inactivated because the castor oil is heated. Clinical symptoms include severe nausea, vomiting, diarrhea, renal failure, and that's what a castor plant looks like. These are actually little beans that contain the rice. Those little beans contain the ricin. Rhubarb, the plant that grows wild. Leaves are toxic. Heating does not destroy the toxic principle. The stem, though, but the leaves are toxic. So if your dog's chewing on the stems, it cause abdominal pain, diarrhea, tetany, and renal failure due to calcium binding. Here's the rhubarb leaves. There's a stem. You may have had rhubarb. Okay, back to rhubarb. So if the dog chews on the stem, there's issues. That's what the rhubarb stem looks like. There's the leaf again for you to see. Flowers of rhubarb plants. You may have seen this growing wild. It does grow wild. Jimson wheat. See, this grows in here in the south. These plant alkaloids that the plant contains. Use of this plant's gone back for years and years. Long time ago. It's an anticholinergic type of plant. Animals get toxic when they chew on the pods out there. Things like hyoscyamine, scopolamine. These are muscarinic blockers. Actually block the ability of acetylcholine to muscarinic receptors. Highest concentration is in the seeds, but a 10 milligram of atropine per seed, so you can see it's a pretty large amount. It can cause pulmonary risks like that from this. Humans have smoked the leaves of the plant trying to get high, but things like tachycardia, dry skin, hyperpyrexia, things like that can cause death. Bad as that, you may have heard this before, as a red as a beet, dry as a bone, blind as a bat, hot as a hair. Those are the symptoms of atropine toxicity. There's a plant. It's called Angel's Trumpet. Very pretty plants grow wild in here. It's a seed pods, these thorny seed pods that have bean seeds in them. That's what the seeds look like out there. Poison ivy. Can dogs get poison ivy? Yes. Not commonly though, but the problem that you got to worry about with poison ivy is they can actually transmit to you. So if a dog runs through a poison ivy plant and then you pet, you can get poison ivy. It's your Rochal. It's a toxic principle. Can be transmitted from dogs or horses to you. So even smoke from burning leaves. Some counties outlaw the burning ivy because you can get it from inhaling the burning poison ivy plants. Still allergic. About 57% of the population is allergic. It does penetrate the skin, binds to lipids, membrane lipids, and causes intense itching. As I said, you can get it from breathing the smoke. So can dogs. Leaves of 3B. That's what we say. Here's what poison ivy looks like. Again, leaves of 3B. So you see 3 leaves. This grows up to any part of the plant's toxic. The stems, the leaves, all this is toxic. Leaves of 3, leave of 3. That's what poison ivy looks like. So if your dog's running through this, you pet your dog, that's what you can get it. And dogs get it too, but usually just in the hair areas of the skin. Poison ivy rash looks like, itches like heck. Your poison ivy on a dog, they can get it. This is the case. So actually the poison ivy dog is poison ivy here. So dogs that get in the hairless areas to the skin. Morning Glory, used to play with these when I was a kid. My grandmother grew these and just spin these in the air. They look like a little parachute. They do contain lysergic acid, which is drug LSD, so they can cause hallucinations, things like this. The American Indians use for for years is ceremonial plants to induce visions, hallucinations, and visions. Again, as dogs chew on these, as you may have seen these plants, they're very pretty. They grow usually up vines, up external iron grill work, things like that. There you go, glory plant. Chinaberry tree, all points plant basically are toxic. The berries, the bark, flowers, and the leaves causes pretty severe GI tract symptoms, and you may have seen these chinaberry. If your dogs chew on these seeds, that's a problem. These little berries fall off the tree, and they everywhere. Mushroom toxicity. Mushrooms can be a real problem. Basically, anything that grows wild in the yard or out in the woods, I wouldn't eat. And if your dog's chewing it, you got to put it there as well. 14 times on our side there, so you do induce on a dog that usually takes care of most of the problem. Amity pylorus, about most of the fatality in the United States in humans, animal fatalities. Basically, raw uncooked mushrooms, heating does not render the toxic mushrooms non-toxic, so heating doesn't help. Usually onset animals get them in feed or hay, get them sometimes in the woods or in your yard. I don't know about you guys, but all mushrooms look the same to me, so I'm not a mycologist, can't identify these things very well, but these are all toxic. These are psilocybin mushrooms. Psilocybin mushrooms grow in cow manure, and these are hallucinogenic mushrooms. As I said, you can see these in cow pastures often. Cows may eat these and cause issues. People eat these to induce hallucinations. Green gill, these are old toadstools growing in your yard. They are toxic. Mushrooms are also toxic. There's a cool website here where you can find out a website for poison plants and animals. There is a poison hotline. They do have a charge for you. They do charge money for that. This is a great website to find out different species of toxic plants if you're interested in that. So I reckon if you are interested that you go to this website and look this up and pursue this. Herbal agents, these are mostly derived from plants. They're not regulated by the FDA. The real concerns you're going to be concerned with whenever you recommend supplements, full supplements to people or to animals in this case, that we veterinarians should not be recommending to people, and chiropractors should not be recommending without going through the veterinarian, but they're not regulated by the FDA, so C in concentration is a concern. So you've got to make sure that you're getting from a very reputable company out there. They can be very potent. They are drugs. People think, oh, they're herbs. They're not drugs. These are drugs. And I get tickled sometimes at my chiropractic, friends and students who say, well, chiropractic is a treatment of disease without the use of drugs or surgery. And I agree. And then they start recommending supplements and herbs to people, and I'm saying you're treating disease with drugs. So you really are prescribing drugs when you're doing that. In the case of animals, they can only be recommended by a licensed veterinarian. What I've put together a bunch of different herbs here, and I've tried to the ones that give you the research that's out there to support their efficacy. You use them at your own risk, and I don't, guarantee anything as far as efficacy, but this is what's published in the data. Aloe is a herd of aloe vera. It has a laxative cathartic. The gel can be used to treat topical wounds and burn and things. It does promote wound healing. Adverse effects, it can cause GI tract upsets and diarrhea in some cases. Anthraquinones can be used in their GI tract irritants and can have a purgative effect. So basically you got to watch that. Ace Manna is derived from aloe gel. I mentioned Ace Manna. Ace Manna was a drug used early on in the treatment of AIDS. This is used to treat fetal leukemia virus. We did some early research on Ace Manna. The clinic I worked in, myself and several other people did some early research with a lab here in Dallas. But just there's aloe vera. You've all seen this. Arnica a lot, both the homeopathic arnica as well as straight arnica. It's an anti-inflammatory. They used to treat pain in dogs. increase inflammation, things like that, decrease pain. Adverse effects, is used to topical application. You should use topical. Homeopathic preparations are safe for internal use, but you don't want to use it on open wounds, and this is what arnica looks like. Again, homeopathically, arnica is used orally, otherwise it's used locally. Astragalus improves renal function, may delay senility. Or maybe we old timers should be taking it. I was kidding. It has an effect, does lower blood pressure, increases myocardial blood flow, makes the immune system used in cancer patients undergoing radiation therapy. Uses astragalus in cancer patients with some efficacy, and there's no that have been reported. There's astragalus. There's a flash. Bilberry, which you probably know as blueberry or huckleberry, it's used to improve visual acuity. There's controversial research on this. There's contradictory research. Some say it does increase night vision. Some doesn't. I've used it primarily as an antioxidant. No adverse effects have been reported. There's blueberries. Black coash, it can be used in animals who've had ovarian histories and leaking urine. It may actually help as far as urinary leakage, things like that go. So for what it's worth, black coash, it can cause elevation of liver enzymes. Use it long term. Also supposed to be an anti-inflammatory for use in osteoarthritis. I've used female patients. The spayed female leaking urine, and I have had some limited efficacy with that. I'm usually going to adjust those dogs. There's coash. Black walnut, interesting herb. It was used by kids for a long time. They used to scatter in their homes fleas and parasites. It's used to treat ringworm, GI parasites. Walnut all been used to treat hyperlipidemia in patients. It can cause, supposedly, black walnut shells that cause laminitis in horses. So I'd be careful with that. If they're moldy, the can contain a neurotoxin which you remove from stalls, things like that. There is some research out there supporting treating heartworm disease in dogs. As far as the published articles, there's not out there. So it's more anecdotal type of research studies. Again, no double-blind studies have been done. I have had 3 cases in which students could not afford heartworm treatment. We put them on black walnut, and the dogs cleared. I realized the dogs would clear in time anyway, but they cleared much quicker than I thought if they'd just been up for time, because the heartworm will die. So anyway, for what's black walnut's been used to treat different parasite infestations in spaniels. Black walnut. Boswellia. Boswellia is a fairly herbal supplement used to treat osteoarthritis, asthma, things like that. Adverse effects are rare. It's more of an anti-inflammatory agent. And I'm sorry, the picture's so blurry, but that's Boswellia. Burdock, interesting, used to treat chronic skin disorders. It's used as an antitussive in cats. Again, there is limited research on this in herbal supplement books. So for what it's worth, I would look at the dosage if you're interested in this. You know, adverse reactions are rare. Can cause what's called burr tongue in dogs, which is kind of like a film on the tongues of dogs. Here's burdock. Calendula can use as a mastitis salve in cattle and dogs. You treat gingivitis, you can treat oral conditions in dogs with this. It's a wound cleansing agent for allergies to the plant, but for gingivitis, epulis, things like this, it can be used used topically. There it is, kind of a pretty plant. My favorite, cilantro. Cilantro is kind of a cool agent. It can be used as a chelating agent. It does increase the excretion of lead and aluminum and mercury in the body. No adverse effects have been reported from this. Of course, mix cilantro, mix it with tomatoes, chopped onions, chopped jalapenos. We call that pico de gallo down here in the south, and it's great. Horrible picture of cilantro, but you know what it looks like. Cranberry fruit. Cranberry is an area acidifier. Used to treat and prevent urinary tract infections. Uses a diuretic. Animals with renal insufficiency or with stones, some oxalate stones. Cranberry has a high oxalate content, but it does use acidic urine, and used in cystitis cases in dogs and cats. Don't use cranberry juice or cranberry cocktail. Use a cranberry fruit. Use a powdered fruit, dried. And there's cranberry. Echinacea. Echinacea uses an immune stimulant. There's controversial research on this out there. Some say it works, some doesn't. I'll just tell you it's used to fight infections, promote healing, interfere with immunosuppressive drugs, and may exacerbate allergies. So be careful. There's echinacea. Garlic, gosh, garlic's been used a long time to stimulate the immune system. The natural antibiotics also use a dewormer. Some animals have sensitivities to garlic, especially using the Keeshans in dogs like this. Be very careful. The Akitas, the Shiba Inus also have issues with this. Can cause anemia in these dogs, so be careful using it in these dogs. Cats may be sensitive to the oxidative damage caused by this, and the hemoglobin causes red blood cell rupture, so be careful with this. Cats, I've used garlic in dogs as a vermifuge or as a deworming agent without any problems, but again, certain breeds, Shiba Inus, Akitas, Keeshans, always be very careful with them. It contains LSD. Of course, it's garlic. Ginger. Ginger's been used to prevent motion sickness, control nausea. It's used in appetite. Also used to treat arthritis, improve circulation, especially in geriatric patients. It should be in instead of is. Adverse effects. You should not use in patients with gallstones, patients on anticoagulants, or patients who have sensitivity to ginger. It can cause dermatitis in some patients. There's ginger. Hawthorn. I use a fair amount of hawthorn in my dogs and cats. It's used to treat heart failure. Hawthorn, it supports cardiac function, increases, it makes the heart beat more effectively. It may help reduce blood pressure. It also has a diuretic effect. So dogs who come in with early stage 1 congestive heart failure, cats with hypertrophic I'll put on hawthorn, and initially the herb of choice. It seems to help the animals and tends to delay having to start more powerful, stronger cardiac drugs, cardiotropic agents. So for what it's, hawthorn works fairly well for cardiac conditions, and I fair amount in my practice. Kava kava is supposed to be an anxiety agent. Don't use it in pregnant or lactating animals. It can cause toxicity. I've never used it in dogs. I do know a couple of veterinarians who've used it as a calming agent in animals who have anxiety. I've never used it. Kava kava. Milk thistle. Milk thistle is use a fair amount of this because of its liver sparing effects. Silymarins, the active is more prevalent in the seeds of the plant. If you get milk thistle, it's the seeds, not the roots or leaves, which have very little iron in them. It can used to treat liver disease. It does tend to increase cell membrane, or the cell membrane of the liver cells. It decreases free radicals in the liver. And I've used this a lot in cats and dogs with liver problems, increased ALT, SGPT, OD, things like that. So basically, it's a very efficacious herb when it comes to liver disease. And there's the milk thistle. Slippery elm, used to treat inflammatory bowel disease, constipation, tonsillitis, anal gland abscesses, UTIs in cats. Some animals are allergic to it. Be careful with that. But just to coat the GI is what it does, and it helps the passage of stools and things. And the reason it treats preanal anal gland abscesses by decreasing constipation, by causing the stool to be soft and not cause as much irritation when they pass the stool. Tea tree melaleuca. Melaleuca's been compounds out there. It's used as an antiseptic, antimicrobial agent applied topically. Used to treat fungal infections, yeast infections, bacterial skin infections. It can cause irritation. Do not give it orally. There's a tea tree. Turmeric and a lot of compounds out there, anti-arthritic compounds. It is anti-inflammatory, antioxidant, supposed to also cancer development, protects the liver from toxins, increases the flow of bile, aids in digestion. Used to treat arthritis. Curcumin, which is the agent that has turmeric in it, is used by curcumin to treat arthritis in dogs. It is a very yellow colored plant, root, herb, and it will stain things yellow if you use some herbs, so be careful with that. But it's what gives East Indian food, things like that, that yellow color to the curry and things. The color is the turmeric. And adverse reactions can cause diarrhea. Supposedly bile duct obstruction has been reported. I've never seen it. I've used curcumin as an anti-arthritic agent in lots of dogs throughout the years. And there it is. Valerian root, again, used fairly frequently. It's used to treat anxiety, insomnia. It's used to treat epilepsy or in the treatment of epilepsy. In case of epilepsy, I'll have the patient start them on valerian root and may keep them off the drugs. I also, in those epileptic patients, check them for thyroid. Throw in as a little tidbit. Make sure they're not hypothyroid as well. It can cause excitability and substance uneasiness, supposedly cardiac disturbances. I've never seen this. I've used a fair amount of valerian root over the years just because it is a calm dogs down prior to coming into the clinic. Willow bark's a source of salicylic acid, which is, of course, salicin, which is the source of aspirin. It's an NSAID. It's an anti-inflammatory, non-steroidal anti-inflammatory drug. I remember when I was a kid, my grandma went to the yard and picked some of the bark off the white tree that was in the backyard, and she'd chew on bark for headaches as a source of salicin. So she used a natural aspirin. If you use the willow bark as far as the herbal agent, the risk of toxicity in cats is low, although they say it can cause nephropathy and kidney problems and if used long term. I've never used in cats, and again, for dogs, I go straight to just good old bare aspirin. Again, I try to use the buffered forms of aspirin. I'll make sure I always give it with food. So, that's a quick overview of herbs. There's some excellent books out there on herbal supplements that if you're going to get into herbs, I recommend you get because it's a whole different treatment. There's Veterinary Medicine book by Susan Wynn and Barbara Fugere that I recommend. Is by Mosby. It's a good book on veterinary herbal medicine, and it goes through a lot of these herbs and a whole lot more that I mentioned, things like root and there's just thousands of them. I just pick some common ones out there. It does go over the toxicities. It goes over mechanisms of actions. It does quote the research that's out there in this. So I mean, if you're into herbs, the book by Mosby, Veterinary Herbal Medicine by Susan and Barbara Fugere, is a good book to get for that. So questions, let me know. Now this was a 2-hour lecture, and we've come down because I went through it very rapidly, very hurriedly, so you don't have to take much longer than you have to. But if you have questions, be sure to let us know. And God bless. See you in class.